Dr. Milton Erickson was called to assist a woman who had severe depression. He agreed to one visit with this woman, and when he got to her home, he found the place in a state beyond what he had imagined. Amongst the mess, he found one wilting African violet. The woman loved this flower, and Dr. Erickson encouraged her to take care of it. He wanted her to tend to it and to help it grow. He also encouraged her to look through the newspaper, find different events like birthdays or anniversaries that were coming up, and to send some of the flower to each person celebrating one of these upcoming events. The woman followed through, and this task gave her purpose in life and produced an immense amount of joy in her life. As she continued to do this for many years, the woman eventually became known as the African Violet Lady. And this is a story that inspired solution-focused brief therapy as we know it today. My name is Keegan. I recently graduated with a master's degree in counseling. I'm making videos like this to help you prepare for the NCE, the CPCE, or whatever counseling exam you might have coming up. Solution-focused brief therapies depart from some of the common beliefs that we find in most other therapies currently. Specifically, one of the beliefs of many therapies that exist currently is that you have to analyze and understand problems that came from childhood. With solution-focused therapies, though, this is not an emphasis. In fact, solution-focused therapies instead look toward the future and are much more goal-directed. With many of the therapies that look into the past, they try to use a problem-solving approach. Another way that we could think about this is that the therapist and the client will look into past events that have happened and try to find solutions or apply those solutions to find a resolution now. However, solution-focused therapies do not view this as important and actually view it negatively. Their view is that focusing on the past will negatively impact the current therapeutic relationship. Additionally, they view looking at the diagnosis as also focusing on a problem. So instead, solution-focused therapists will help their clients with solution building. Their belief is that the simplest solution is probably best, and finding the easiest, most direct way there is preferred. A core belief of solution-focused therapy is that a client should do more of what works. Therefore, solution-focused therapists may use the continuation question. With this question, the therapist would ask the client to observe what's happening in their day-to-day life between now and the next session. They then ask the client to report back with what they would want to continue to happen in life. A solution-focused therapist might also ask the client in a session what they would want to continue to happen in life. These are two versions of that continuation question that's pretty important in solution-focused therapy. There are three major principles or ideas in solution-focused therapy that we should probably try to understand. The first is pretty simple. If something isn't broke, we shouldn't try to fix it. Second, they have a belief that clients end up finding solutions to their own problems in life already, and that with some questioning and understanding of what's happening in the client's world, they've actually probably found a solution to the problems that they're presenting with, but that they just don't see it in that same way currently. Third, they have a core belief that if something isn't currently working or hasn't worked, we shouldn't do that again. We should do something different. Before we get into how solution-focused therapists might interact differently with clients, if you're enjoying this video and finding it helpful, please help me out by giving it a like and subscribing so that you don't miss any future videos. Solution-focused therapists end up approaching clients in a different way than many other therapies currently encourage therapists to approach the client. The way that solution-focused therapy views it is most other theories in psychology encourage or end up with the therapist appearing as all-knowing in some way. However, a solution-focused therapist is encouraged to take the opposite approach to this. This means that instead of being all-knowing, a solution-focused therapist will try to take approach of not knowing. With solution-focused therapy, the therapist is encouraged to suspend judgment and to be curious with the client. The view is that for an all-knowing therapist, they can't be both all-knowing and curious at the same time. And so therefore, solution-focused therapists embark on this lifelong task, they say, to refine their skills in not knowing, in being curious, and being able to suspend their own judgments so that they can get to know the client better and what's going on in their life. Again, solution-focused therapists don't focus on problems or what needs to be fixed in the client's life. They will even take the position of problem-free talk, encouraging the client to talk about what's going well in their life and what they want more of to happen in life. The solution-focused way is to build on the client's successes, to find their strengths, to understand what resources they have, and to work to grow their abilities. They feel that big problems can often have small, simple solutions. And they also hold the belief that small changes can create ripples that will impact many other areas of life. This was a brief look at solution-focused brief therapy. Let me know what other questions you have about solution-focused therapy in the comments below. I'll do my best to reply to those or to make more videos to expand on that. Thank you so much for watching, and I'll see you in the next video.